Very much. Thank you, Minister. And um, my question isn't on something in the bill. It's on something that I expected to see in the bill, but it's not there. And that's additional funding for healthcare because our healthcare system's in a crisis. And I was watching an article tonight. Some children in British Columbia have died. And we know that people are having a lot of problems accessing healthcare. There's lineups at clinics. People don't have family doctors. They're waiting for surgeries. And the list goes on and on. And there seems to be some sort of jurisdictional dispute between the federal government and the provincial government. I'd like to know, like, when is the federal government going to take control? People now believe that healthcare is their top priority. That's the top problem in the country, and that the government has lost touch with the common person. They don't understand, they don't realize that we have a crisis in healthcare. I'd like to know, when is the government going to take control of the situation and work towards a solution to this very major problem?
Well, thank you for the question. I very much agree that we need to do, as a country, we need to do better on healthcare, and that a lot of Canadians, whether it is children and parents of children or our seniors, are facing real challenges when it comes to getting the care they need and deserve. Um, I have to sort of say, the notion that there isn't a jurisdictional dispute on healthcare. Healthcare is very clearly the jurisdiction of the provinces and territories. And if I were to say to a premier or a provincial minister anything different from that, I would hear otherwise really quickly. But the federal government absolutely recognizes that we have a role to play in supporting provinces and territories in delivering healthcare, in funding the healthcare system, in providing data across the country, in coming in emergencies as we did with vaccines. My colleague Jean-Yves Duclos is working very hard with his provincial and territorial counterparts, and we committed in the campaign to provide additional healthcare funding. We will do that, but I also believe, Senator Marshall, that it is not only a question of funding. It is, first and foremost, for Canadians, a question of getting better healthcare outcomes and results. And Canada actually spends at the high end of the OECD, as you know, but our results are not consistent with that spending level. So what we believe is, as part of that conversation with the provinces and territories, we need also to find ways to commit to Canadians that we're going to deliver better results. And I am confident. I agree with you. There's a challenge. I am confident that we are going to find ways to address that challenge, because you're quite right. Canadians are insisting that we do that.
But the system is continuing to deteriorate. And at what point does it have to deteriorate to how low a point before the government does something? It's not going to get better. It's going to get worse. And unless something is done soon, we're going to see a very rapid and very significant deterioration, further deterioration in the healthcare system.
Madame la ministre,